Okay, so let's talk about Missy Beaver. I've seen it, you've seen it. What does she do that is reversing symptoms of Parkinson's, MS? What do you see from a scientific standpoint that makes what she's doing work?
When she came to me, that her soft tissue work or the deep tissue work she does was releasing spasm in muscles and releasing the chronic rigidity from the movement disorders. Parkinson's is one. And that by releasing that tension, she was seeing the patients function better. She was seeing them move better. She was seeing them need less medications. I frankly, when I first met her, had my questions whether that was real or not.
And so what made you think there's something to what she's saying?
Well, Missy brought several patients in to see me that she had been treating, and I listened to them, and they had said they had seen a change after as little as 4, 5, 6 treatments, and they could walk better, they could move better, and they seemed to need less medication.
Did you believe it?
Many degenerative diseases are a cycle, where if the brain's not functioning, then the body doesn't function, the rigidity sets in, and it's a cycle. And I think she's actually breaking the cycle, in her case, by releasing the muscle spasms, restoring nerve impulses, restoring blood flow, and that's down-regulating the cycle so the patients are actually functioning better.
Okay, so you meet her people, and I'm sure you've got doubt there. You're a neurosurgeon, accomplished guy. She doesn't have any credentials, not even a physical therapist, really. What happens? You send a couple patients to her. Why and how?
Well, she actually is a licensed soft tissue therapist or licensed massage therapist. And I sent several patients that were my patients that had movement disorders to her to see what the result would be. So I sent her several patients to try and see what happened.
Parkinson's patients?
2 of them are with Parkinson's.
What happened?
Remarkably, one who has very advanced Parkinson's came back after as little as 6 or 8 treatments. He'd been in a walker and now is walking with nothing or a cane, a simple cane. His medication use has dropped. His legs are not as swollen, and he's a lot more functional.
What about the other one?
The other one's showing similar improvement, just started treatment, and is showing less rigidity, walking better, and moving better. So there seems to be something.
How do you explain that medically, scientifically?
I think it's explained that there are a lot of syndromes in the body that are, as we call, reflexes or reflex arcs. They're cyclic. There are many diseases that are like that. Reflex sympathetic dystrophy, probably some types of response to multiple sclerosis, Parkinson's. They're degenerative loops. And Parkinson's is treated with deep brain stimulators where they put a probe in the brain and that interrupts the loop. Missy seems to be interrupting the loop by massaging and releasing the muscle spasm in the muscles. It could make some sense how it actually works. She's breaking the cycle.
Why has nobody found this before?
We've concentrated so much on all the research on degeneration in the brain and the neurotransmitters that are not correct and the replacing them with medications that I don't think people have concentrated on the potential non-surgical or non-medical treatments.
So you think there's something to her?
Well, I've recommended we do a formal study where we actually have one of our MDs, a physical medicine rehab doctor, do an independent evaluation, see the patients before, during, and after, do a analyzed disability analysis, look at their medication use, score it all, and see what an actual real study comes out. But from what I've seen from the few patients she's treated, there's been some pretty incredible results.
So you're sending your Parkinson's patients who there's nothing more you can do with them?
Well, I'm not a primary treater, I'm spinal disease.
Right.
So I see Parkinson's patients that are under treatment from other doctors, from neurologists. I see them because they also happen to get a lot of spine disease. So I'm really treating them for their pain or spine. And their neurologists are treating them with their medications. So I've suggested her treatment to the people that are coming in, and we're going to continue. And then she, through her contacts, is bringing in some other patients, which we will study, and we'll look and see what the outcome is. But from what I've seen from anecdotal results, the patients are really quite a bit better.
Shocked? Are you shocked?
I have to admit I was a bit shocked to see, but in theory it does make some sense that no matter how you interrupt the cycle, whether you interrupt it with medications or you interrupt it with a deep brain stimulator or you interrupt it with soft tissue release, if you break the cycle, you can see improvements. It does seem to make some sense.
If your trials work, what will you do?
Well, if a pilot study works, then the next step would be obviously to enter a much larger study or a multi-center study, and that would have to be designed and overseen and put into the academic sphere of being done on a big scale. And Missy's impatient; she wants it all out tomorrow, and I can understand why, seeing some of her patients. But it would have to go through a stepwise look through the academic cycle to look and validate the whole study. If it does validate all the way through, it opens up a whole new field of treatment for movement disorders.
Wow. She apparently had a golfer patient of hers who she came in and pushed you, I guess, I don't know if she told me the story right or if there was something in there. She claimed that there was a guy who had a problem with his knee and nobody could see it and find it, and she convinced you to let some doctors look at it. And does that...
Missy had a pro golfer that she treats that had an old fracture that had a metal plate in his knee, and he could never get the range of motion back in his knee. And to first look, the plate wasn't stopping any range of motion. It shouldn't really stop it. But she said every time she repeatedly treated him, he just locked back up again. And she came in and suggested that we look seriously at the plate because she thought it was bothering him. So I had one of our orthopedic surgeons look at the plate, and subsequently he removed it. And after he removed it, the golfer's been able to get back out, get his motion of his leg back, and really get moving. We found the plate had some loose screws in it, had some motion, and really could be causing some problems. But Missy encouraged us to take it out, and the patient really wanted it out because he felt it was causing a problem. Turned out they were right.
So she caught it and the orthopedist didn't. That were treating him, not your orthopedist, but the other guys. Nobody. She caught it when doctors couldn't.
Well, he'd seen several doctors who told him they didn't think the plate was causing a problem. And I think it just points out that people really need to be, especially the doctors, need to be really open-minded to what the source of the problem may be, especially when it comes to chronic pain or chronic spasm.